Hello, and welcome to Health Talk Made Simple by Aziz. We are so glad you've joined us. This channel was created with one simple but powerful goal in mind: to take complex medical topics and make them clear and understandable for everyone. We know that receiving a medical diagnosis, especially for a condition like kidney disease, can be an overwhelming and often frightening experience. Suddenly you're faced with a world of new terminology, tests, and treatment plans that can feel confusing and intimidating. Our mission here is to cut through that confusion. We believe that knowledge is power, and when patients and their families truly understand what is happening inside the body, they feel more in control, more confident, and better equipped to navigate their health journey. We're here to be your guide, breaking down the science into simple language, using clear visuals and relatable analogies so you can become an active and informed partner in your own care. In this channel, we explain kidney health in a very simple way so patients and families can understand what is happening inside the body. Think of your kidneys as the silent, hard-working heroes of your body. They are sophisticated, tireless purification plants that work 24 hours a day, 7 days a week, without you ever having to think about it. They perform a delicate balancing act that is absolutely essential for your survival. When this balance is maintained, your body thrives. But when it's disrupted, the consequences can be serious. That's why understanding their role is so incredibly important. Today we will talk about something very important. We're going to pull back the curtain on two of the kidney's most critical jobs: managing the fluids in your body and balancing vital minerals called electrolytes. We'll explore how the kidneys balance fluids and electrolytes like sodium, potassium, calcium, and phosphorus. These might sound like words from a chemistry class, but they are the essential building blocks for your health. Sodium helps control your blood pressure. Potassium is crucial for your heart's rhythm. And calcium and phosphorus work together to keep your bones strong. Your kidneys are the master chemists that keep each of these substances at the perfect level. But what happens when these amazing organs can no longer do their job? This leads us to the second part of our discussion. We will also answer an important question: why dialysis can become a life-saving treatment. For many, the word dialysis is associated with fear and uncertainty. But by the end of this video, our goal is for you to see it differently. We will explain exactly what happens in the body when the kidneys fail, why the buildup of fluid and toxins becomes so dangerous, and how dialysis steps in to perform the essential work the kidneys can no longer do. Understanding this process is key to seeing dialysis not as a burden, but as a vital tool that protects the heart, the lungs, and the brain, ultimately sustaining life. So let's begin this journey together, starting with the basics of how your incredible kidneys work. To understand how kidney failure affects the body, we first need to appreciate the incredible job our kidneys do every single day. Most people have two of these amazing bean-shaped organs. They are located on either side of your spine, just below your rib cage, and they are essential for keeping your entire body in balance. Think of them as your body's own highly advanced intelligent filtration system. They are not just simple strainers. They are incredibly smart, constantly making decisions about what your body needs to keep and what it needs to get rid of. This process is happening continuously, 24 hours a day, 7 days a week, without you ever having to think about it. The sheer volume of work they handle is staggering. Every single minute, about half a cup of blood flows from your heart and enters your kidneys to be cleaned. Over the course of a day, this adds up to them filtering all the blood in your body more than 40 times. Inside each kidney are about 1 million tiny filtering units called nephrons. As blood passes through these nephrons, a complex process begins. First, waste products, extra water, and other substances are filtered out of the blood. But the kidneys are smart. They know your body still needs certain things. So, in the next step, they carefully reabsorb the precise amount of water, minerals, and nutrients your body requires to function properly, returning them to the bloodstream. Everything that is left over, the things the body does not need, is converted into urine. This includes waste products from the food we eat and the normal breakdown of tissues, extra water that we drink, and extra minerals, which are also known as electrolytes. This constant cleaning and balancing act is what keeps our blood healthy and our bodies running smoothly. Electrolytes are important minerals in our blood. They help our body work normally. Some important electrolytes are sodium, potassium, calcium, phosphorus. The kidneys constantly adjust the level of these minerals. The kidneys also control how much water stays in the body. If you drink too much water, the kidneys remove the extra water in urine. If your body needs water, the kidneys save it. This keeps the body balanced. Sodium, also called Na, is very important. It helps control blood pressure, fluid balance, nerve signals. The kidneys remove extra sodium through urine. This keeps the body stable. Potassium is another very important electrolyte. Potassium helps control heart rhythm, muscle movement, nerve signals. The kidneys remove extra potassium every day. This keeps potassium at a safe level. Calcium helps keep bones strong. It also helps muscles and nerves work properly. Phosphorus works together with calcium to keep bones healthy. Healthy kidneys keep calcium and phosphorus balanced. When the kidneys stop working well, the body loses this balance. The kidneys cannot remove extra water, waste, extra electrolytes. So these substances begin to build up in the body. When kidneys fail, extra water stays in the body. This causes swelling in legs, feet, face. Fluid can also collect in the lungs. This can cause shortness of breath. High potassium is very dangerous. If potassium becomes too high, it can affect the heart. The heart may beat irregularly. In severe cases, it can even cause cardiac arrest. When phosphorus becomes too high, it pulls calcium from the bones. Over time, this can cause weak bones, bone pain, severe itching. This is very common in kidney failure patients. The kidneys normally remove waste products like creatinine, urea. When kidneys fail, these wastes stay in the blood. High levels can make patients feel tired, nauseated, confused. Too much fluid can move into the lungs. This makes breathing very difficult. Some patients come to the hospital gasping for air. This is a medical emergency. When kidneys stop working, dialysis can do part of the kidney's job. Dialysis removes extra fluid, waste, dangerous electrolytes. This helps protect the heart, lungs, brain, and the rest of the body. That is why dialysis can become a life-saving treatment. Many patients ask, is dialysis really necessary? When the kidneys can no longer keep the body balanced, toxins and fluid keep rising. Eventually, this can affect the heart, brain, and lungs. In many cases, dialysis becomes a life-saving treatment. Thank you for watching Health Talk Made Simple by Aziz. We hope this video has given you a clearer picture of the incredible work your kidneys do every single day. We've learned how they act as the body's master chemists, carefully balancing fluids and essential minerals like sodium, potassium, calcium, and phosphorus. Understanding this balance is the first step to understanding kidney health. We also walked through what happens when this delicate system is disrupted by kidney failure. We saw how the buildup of fluid can lead to swelling and difficulty breathing, how high potassium levels can pose a serious risk to the heart, and how an accumulation of waste products can make a person feel very sick. Most importantly, we explained why dialysis is not just a treatment, but a life-saving intervention that steps in to perform the vital functions the kidneys no longer can. Our goal is to demystify these complex medical topics, transforming confusion and anxiety into clarity and confidence. Knowledge is a powerful tool, especially when you or a loved one is navigating a health challenge. It empowers you to ask informed questions, understand your treatment options, and become an active partner in your own healthcare journey. If you found this information helpful, we encourage you to share this video. You never know who in your circle might be looking for simple, trustworthy explanations about kidney disease. By sharing, you can help someone else feel less alone and more in control. Please consider subscribing and joining our community. We are committed to creating more content to support patients and families. In future videos, we plan to explore topics like the different types of dialysis, dietary guidelines for kidney patients, and what to expect when living with kidney failure long-term. Your journey is important, and we are here to provide clear, simple, and supportive information every step of the way. Thank you again for your time and attention.